Many people struggle with glare when they drive at night. Headlights can feel painfully bright, road signs might look fuzzy or blurry, and all of this can make your night driving very, very stressful. Because of this problem, which is not uncommon, there are many places that sell anti-glare glasses that give you the promise of having clearer vision for night driving. But before you spend the money on them, there are 5 important things that you need to know about what anti-glare glasses really mean for night driving and the best ways to actually improve your night driving. Hi, my name is Dr. Nagori. I'm a board-certified ophthalmologist, and you're watching the iFacts.com channel. Number 1 of the 5 things that you should know before buying these glasses is that the yellow anti-glare glasses actually have the potential to make your night vision worse. Wait, what? I thought this was the opposite of what they're supposed to do. Well, the research that exists about these glasses does show that they can actually reduce visual clarity. So even though the yellow tint might actually help with glare, there's not really good data to support their general use because of the fact that they may actually reduce your clarity. So they may do a good job at decreasing glare, but they may also reduce clarity. So why is this? The reason is that the lenses actually can block part of the light from entering the eye. And during the day, this may not matter that much, but at night, your eyes need as much light as possible. In fact, your body has a mechanism to allow more light into the eye to support night vision. This is actually an evolutionary mechanism that we have developed over time. Our pupil actually dilates and gets bigger in the dark to allow more light in. And so again, this is an evolutionary adaptation to let more light in when it's dark outside. And so the yellow tint actually can reduce that. Studies that simulated night driving show that yellow lenses can actually make it harder to detect objects on the road, both with and without headlight glare. So again, while yellow lenses may reduce discomfort from bright lights, they can actually reduce visual clarity, which for some patients can make night driving harder. Now there is a caveat to this because driving is also about confidence, mental clarity, and decision making, and the types of roads that you are specifically driving on. It is not just based on your pure vision. For patients who may be night driving long distances on roads with lots of cars, glare may be more of an issue. And for that patient, the yellow glasses may provide enough glare blocking and they still have good visual clarity to see well. But for maybe a patient who is night driving on a long, isolated country road with minimal cars, clarity may be more important than anti-glare. So for my patients who have to deal with a lot of headlights and streetlights, they have tried these glasses because they feel most bothered by the glare. So for those patients, it can be helpful. And for those patients, the potential of reduced clarity is not affecting them as much and they feel more secure when driving. It's an important distinction to understand before you buy anti-glare glasses because you may notice that when there are less headlights around or less street lights around or very little potential for glare, you may not see those small objects running into the road on a dark country road as clearly. So should you try them? Yes, it's important to see what your personal experience is going to be with the yellow tint glasses. And if they don't work, you should know that there are better ways to address night driving difficulties, which we're gonna get into in this video. So number 2 of the 5 things to know before buying anti-glare glasses for night driving is that your dry eye might be the problem that's actually causing the glare. A person who has dry eye is about twice as likely to report night driving difficulty compared to a patient who does not have dry eye, even if their vision test looks normal. Studies show that shorter tear breakup time, which is a sign of dry eye, is strongly linked to worse night driving performance, slower reaction times, and missed targets in driving simulations. And dry eye disease is very, very common in the general population. Not only does dry eye disease get more common as we age, it's also more common in patients who use screens frequently, which, let's be honest, is all of us. In fact, you're watching me on a screen right now. When we do focused visual tasks like watching something on a screen or night driving, our blink rate naturally goes down because we are so focused on what we are doing. This causes dry eye to get even worse. So it's not surprising that dry eye is often an overlooked cause of glare during night driving. The surface of the eye is covered by tear film that needs to stay smooth and stable for clear vision. When the tear film breaks up too quickly, light scatters, and that can create glare, it can create halos, and it can also create starbursts around lights. The good news is treating dry eye, especially mild dry eye, is pretty simple, and it can significantly improve night vision for many people. So before you buy a pair of anti-glare glasses, try using preservative-free artificial tears. They're over the counter, you don't need a prescription, and you can use the tears 3 to 4 times a day, but also you want to consider using them right before you start driving to see if it makes a difference. The third thing to know of 5 before buying anti-glare glasses for night driving is that you may need an update or a change in your prescription. Or if you have never worn glasses, it's possible that you need a small prescription just for driving. The single most effective way to improve night driving is having an accurate distance vision correction. Even really small amounts of nearsightedness, and I have seen this in my office where I am just giving them a tiny prescription. So small amounts of nearsightedness, farsightedness, or even a tiny amount of astigmatism can actually cause major glare at night. Like I talked about earlier, your pupil naturally gets bigger at night or in the dark. And so when your pupil gets larger in the dark, this can actually increase the blur from an uncorrected vision prescription. And you may not really notice this during the day because your pupil is much smaller during the day. Studies show that drivers who get updated glasses prescriptions have large improvements in glare, in distance judgment, and overall night driving confidence. Many people assume that glare is the main problem, when the reality is their prescription is outdated or it's even slightly off. So again, before you buy special anti-glare glasses, make sure you get an updated pair of eyeglasses from the eye doctor, and you can actually have them put special coating, which I'm going to get into, to help with any kind of light and glare during driving. So now number 4 of 5 things to know before you buy anti-glare glasses is a very important one. If you struggle with glare, it is important for you to have anti-reflective coating on your lenses. This is different from the anti-glare glasses. When I, as an eye doctor, think anti-glare, I am really thinking about anti-reflective coating. This coating is not the same as having a yellow tint to your glasses. Anti-reflective coating reduces reflections from the surface of the lens itself. Without coating, the light from the headlights and street lights can bounce off the lens and create distracting reflections. So modern anti-reflective coatings allow more light to pass through the lens, and they reduce the internal reflections. This can improve driving clarity, comfort, and especially comfort during night driving, especially with those really bright LED headlights. Now, in my office, when our patients are getting glasses, we always recommend that they get clear, untinted lenses with anti-reflective coating, especially for anyone who struggles with glare. There is the basic anti-reflective coating, which is a surface treatment for the glasses, but there's also a premium option that is hydrophobic. Not only is the premium anti-reflective coating better for tolerating bright lights, it also has this added benefit of giving your glasses more scratch resistance. So typically, if you see over-the-counter glasses that are labeled as having anti-reflective coating, that will just be the regular kind, like the surface treatment kind that I mentioned earlier, but not the premium kind. But be sure to talk to your eye doctor as well as your optician about that premium coating for your eyeglasses. Finally, the 5th thing to know before you buy anti-glare glasses for night driving is also very important, and it is about a common medical condition. If your night glare is getting worse and worse over time, glasses may not be the issue, glare may not be the true issue, which means buying anti-glare glasses are not going to help much because the trouble with night driving might be coming from a cataract. Trouble with night driving is a very, very common symptom in patients who have cataracts. In fact, patients who have cataracts are about 2 to 4 times more likely to say that they struggle with night driving compared to patients who do not have cataracts. This is mostly because cataracts can cause glare, halos, reduced contrast, and all of these things become much worse in low light conditions. Studies using driving simulations show that even mild cataracts can seriously affect safety. When bright headlights from oncoming cars are present, people with cataracts are much more likely to miss seeing pedestrians. In fact, in one study, missed pedestrians increased from less than 1% without glare to about 6% when headlight glare was added. Cataracts also can affect how well drivers stay in their lane. Drivers with cataracts tend to drift more and drive slower, especially at night, because they feel less confident. A person with significant cataracts is about 2.5 times more likely to be involved in an at-fault car accident over a 5-year period compared to a person who is driving that does not have cataract. Because cataracts reduce the amount of light getting into the eye, and anti-glare glasses with yellow tint can help with glare, but they can also reduce clarity. You may actually make your vision less clear with anti-glare glasses on top of a cataract, depending on how bad your cataract actually is. And you may not notice vision difficulties during the day, but it may get really bad at night. You may be thinking, well, if I have a cataract, it's there during the day too. Why don't I have issues during the day? Well, you're not alone, because many patients with cataracts struggle much more at night and with night driving, as I mentioned, due to the pupil being much bigger at night, and that can increase blur, than they do during the day. So they are often surprised to learn that they have a cataract. We even have a specific exam in the office called a glare test that we do for patients with cataracts before cataract surgery when they say they're struggling with night driving. Because for certain patients with cataracts, they still may see pretty well when it comes to their central vision during the day when there's no glare present. But if we introduce glare into that setting, their visual clarity actually goes down and their vision on the chart will actually drop. And this is what we consider a positive glare test. And in some patients, their vision may drop 2 or even 3 lines just by the introduction of glare. So if you're having problems with night driving, make sure to see your eye doctor first before buying anti-glare glasses, because the glare could have a real medical cause and it may not be something that you can fix with over-the-counter glasses. What questions do you have about your eyes? Drop them in the comments below and I'll do my best to answer them in a future video. As always, hope you found this video helpful. Remember to hit like and subscribe below, and thank you for watching.